The second is optimize the condition of the patient. And the third one is choose surgery. Choose surgery means which surgery we will have to do. Like there are two types of surgery. The first one is palliative surgery, and the second one is curative surgery. In palliative surgery, we are just trying to normalize the symptoms of the patient only. And in curative surgery, we are curing the complete disease of the patient. So we will have to choose the type of surgery, whether the patient have to go through the palliative surgery or the curative surgery. And the fourth point is anticipation. Anticipation, or we can say planning. We have to plan all the things that if let's suppose the complications arise during the surgery, what we will have to do. So these comes in the preoperative evaluation. And the fifth point is adequate hydration of the patient. So these all comes in the preoperative evaluation. And the most important three things which comes in the preoperative evaluations are: the first one is the patient history, the second is examination of the patient, and the third is diagnosis of the patient. So we will have to study the patient history. First, we will have to ask about the general history of the patient, and then we have to go systematic wise. Like in first one, we will have to ask about the cardiovascular system history, yani any history of the hypertension, any history of the arrhythmias, any history of the previous heart attacks. The second one is we will go through the central nervous system. There is any attack of epilepsy or any stroke attacks, we will have to ask in the CNS. And the third one, we will go through the respiratory system. In respiratory system, we will ask about any previous asthma, COPD, any type of chest infection, etc. And then we will go to ask about the GIT disorders, like any type of constipation, stomach acidity, etc. Then we will go through genito-urinary system. Like we will have to ask specifically about the urinary tract infection. And then we will go through endocrine system. And in endocrine system, we will have to ask two important things, that is diabetes, first diabetes, and any thyroid disease. The seventh one is we will have to ask about the locomotion. In locomotion, we will ask any type of locomotory disease, like any type of arthritis. And eighth one is we will have to ask about the any previous surgery. So these 8 points should be asked in the patient history.